Let's imagine that you're out on a run when all of a sudden, you fall into a manhole. The lid was missing, but you didn't notice because of all the leaves covering it. You get out quickly and seem fine. Just some minor cuts. But your doctor suggests you get a tetanus shot.
No! Not tetanus. But wait, what's tetanus?
Just calm down and I will explain. Tetanus is caused by the bacteria Clostridium tetani. Here is a close-up of the virus. It is anaerobic, motile, spore-forming, and...
Stop! I'm sorry, but what does that mean?
All right, I will break it down. Clostridium tetani is slender with a length of 3 to 12 micrometers and a width of 0.3 to 0.6 micrometers. It belongs to the genus Bacillus due to its rod shape. Clostridium tetani is also motile. The motility of this bacteria means that it can move to favorable conditions to survive.
Oh, I get it! It's like when we move to a shaded area when the sun is making us feel hot.
Exactly. Do you remember what color it was from the microscopic picture earlier?
Was it purple?
Correct. The reason why Clostridium tetani shows up as purple is due to a stain revealing it as gram-positive. Gram-positive means that Clostridium tetani has thick peptidoglycan walls, no outer membrane, and exotoxins. Clostridium tetani is sensitive to heat and strictly anaerobic, meaning it can only grow without the presence of oxygen. Their spores, however, are resistant to heat and usual antiseptics, allowing Clostridium tetani to grow in a wide variety of places. This is why Clostridium tetani is found in areas like soil, animal or human feces, rusted tools, and unsterile medical equipment. They are also present in your body as normal flora.
Isn't that dangerous, though? And what is normal flora?
Normal flora are harmless microbes in your body. It is actually a good thing to have them because they help prevent foreign microbes from thriving in your body by being competition for the same resources.
That's a relief. Wait. Then how does Clostridium tetani, foreign microbes, enter the human body?
That's a good question. It starts with our skin, a necessary barrier protecting our bodies. It's our first line of defense, keeping out bacteria like Clostridium tetani. Essentially, any break in the skin gives an opening for Clostridium tetani to move in. Examples would be wounds contaminated with dirt or feces, rusted nail puncture wounds, and burns.
I get it. Our skin is like a wall. The moment there is a crack or any opening in the wall, bacteria can slip in.
Correct.
So what happens after Clostridium tetani slips into the body?
Two toxins are produced, tetanolysin and tetanospasmin. It is unknown what tetanolysin is supposed to do after entering the human body because oxygen destroys and inhibits it. On the other hand, tetanospasmin causes painful muscle contractions.
But there's no way our body just sits back and does nothing. So how does it respond?
That's the issue. Tetanospasmin binds in the central nervous system and blocks the inhibitory neurotransmitters glycin and GABA. This causes excitation, spasticity, and unopposed muscle contractions. Even the autonomic nervous system can be affected.
What do you mean?
Inhibitory neurotransmitters help control excitatory neurotransmitters. When the toxin blocks inhibitory neurotransmitters, you lose control of your muscles.
What about the autonomic nervous system? What's that?
The autonomic nervous system is what controls your body's unconscious, involuntary activities like your heart rate and blood pressure.
Wow. That's why the doctor was so adamant about the tetanus shot. The toxin can do a lot unopposed because it binds in the central nervous system.
Yes, both GABA and glycin have influence over the immune system as well. And I haven't even listed all the symptoms yet. The symptom most commonly associated with tetanus is trismus or lockjaw, where a person's neck and jaw muscles lock. Other symptoms include seizures, trouble swallowing, and changes in blood pressure and heart rate. There are more symptoms, but it varies a little based on the type of tetanus.
There are different types of tetanus?
Yes, there is generalized tetanus, localized tetanus, cephalic tetanus, and neonatal tetanus. Generalized tetanus is the most common and can take months to recover from. Localized tetanus is uncommon, generally milder, and can precede generalized tetanus. Cephalic tetanus is tetanus that starts in the head. Neonatal tetanus happens in newborn infants, usually caused by an unsterile tool cutting the umbilical cord. Aside from the symptoms, there are complications that can occur such as laryngospasm, difficulty breathing, and death. The incubation period, or the time between exposure and first signs and symptoms, can be days or weeks. It varies depending on the distance between the entry site and the central nervous system.
Oh, I see. So the closer the entry point is to the CNS, the shorter the incubation period is. The farther apart they are, the longer the incubation period is. I'm so glad that you're here to explain this to me. I wonder what people did before they understood what tetanus was.
Good question. Let's stop and go back in time. There are records that date back to 5th century BC describing tetanus, but it wasn't until 1884 when Carl and Rattone produced tetanus in animals with injections containing pus from fatal human cases. Nicolaier was also able to produce tetanus in animals that same year by injecting them with soil samples. In 1889, Hidesato Shibasaburo isolated the organism from a human and proved that it was the cause of tetanus by injecting it into animals. He also said that specific antibodies can neutralize the toxins. In 1897, Edmund Nocard showed how effective passively transferred antitoxins were, influencing the use of passive immunization for people during World War I. In the 1920s, Gaston Ramon developed a method to inactivate tetanus toxin using formaldehyde. In 1924, Descombe developed the tetanus toxoid that was widely used during World War II. In the late 1940s, tetanus vaccines became a part of routine childhood vaccination.
Wow! They worked hard to understand tetanus and make the vaccine.
Yes, they did.
Do you know what the death rates were before the vaccine?
Yes. Before the vaccine, there were 500 to 600 cases annually in the United States. The number went down to about 50 to 100 cases annually in the mid-1970s. In 2018, there were 23 cases and no deaths caused by it in the U.S. The mortality rate of tetanus in the U.S. is 13.2%. During 2016 to 2017, 93.3% of 2-year-olds got at least 3 doses of the vaccination and 80.6% of 2-year-olds got at least 4 doses. 63.4% of adults got vaccinated. In 2019, 90.2% of the adolescents, 13 to 17 years old, got vaccinated. Tetanus is uncommon in the United States with an average of 30 reported cases a year, while globally there were 73,000 tetanus cases in 2019. The mortality rate varies between countries depending on the sanitation level. But without treatment, 1 in every 4 infected people die.
So how is tetanus diagnosed?
Tetanus diagnosis is entirely clinical. Laboratory tests are not necessary. Since tetanus is sensitive to oxygen, oftentimes there will be a false negative result just because oxygen ruined the sample. If you are already having symptoms, then do not wait for lab results. It's better to get the tetanus shot before it is too late.
Are there any other medications or actions that need to be taken?
Yes, there are drugs for the muscle spasms, antibiotics, and wound care is needed for the bacteria entry site.
Thank you so much! I understand tetanus better now.
Of course. Well, I have to go now, so goodbye.
Bye!